Articles we cover in this episode of Healthy and Happy Senior Living: cardiovascular disease. Taking 500 more steps each day may help lower risk. A major study: 160 million years of life lost to obesity in 2019. And what can we do about that? If you'd like to succeed in exercise, consider joining a group program, according to a major new study. These articles and more in this episode of Healthy and Happy Senior Living. Hello once again, your host, Stephen Carter, and I thank you for joining me for this episode of Healthy and Happy Senior Living. Who is this show for? This show is for seniors who want to live, a healthier and happier life, and it is for caregivers. Caregivers, whether they are family members, close friends, or professional caregivers, it's important for us all to know the latest research in health and happiness for seniors. Let's begin with a story from Medical News Today. Headline: Cardiovascular disease. Taking 500 more steps each day may help lower risk. Key points: for older people, every additional 500 steps walked during a day reduces the risk of cardiovascular disease by 14%, according to a new study. The health benefits from walking begin at about 3,000 daily steps. According to this research, 500 steps is roughly equal to about a quarter of a mile. 500 steps is roughly equal to about a quarter of a mile. Lead sentence: plenty of studies associate physical activity, including brisk walking, with good health, with much of them focused on young to middle-aged adults. There have been fewer investigations into the benefits of walking for older people. New research, however, explores the ways in which walking can help reduce the risk of cardiovascular disease. Researchers recently found that for people age 70 and older, and I have to say I am in that category, researchers recently found that for people aged 70 and older, each additional 500 steps of daily brisk walking lowered the risk of cardiovascular disease by 14%. In addition, individuals who walked roughly 4,500 steps each day lowered their risk of cardiovascular disease by 77%. 77%. This research presented to the American Heart Association's Epidemiology and Prevention Lifestyle and Cardiometabolic Health Scientific Sessions 2023. Ongoing, more steps decrease risk. The research involved 452 participants from the ongoing study that they quote here. Participants' average age was 78, 59% were women, 20% self-identified as Black, 70% of whom were women. An important word of caution here: before engaging in any exercise, please consult your physician. This article, as all articles will be, you'll find this article linked in the show notes. Walking can help us with cardiovascular disease prevention, but here's an interesting story. 160 million years of life lost to obesity in 2019. So exercise, of course, is truly a magic elixir for helping us stay strong, stay young, stay fit, and it may also help us deal with obesity. Researchers at the National University in Singapore and colleagues in the U.S. and China undertook a 2-decade metabolic analysis of global burden of disease reports, and they published their findings in the journal Metabolism. While previous studies of GBD data have focused on the increasing number of deaths and disability-adjusted life years in individual diseases, researchers in this study wanted to provide insights into the trends and burdens of metabolic diseases as they are so closely interlinked. Understanding what makes a long, happy life can be challenging to quantify, though avoiding death must be a significant consideration. Understanding what ends a life, happy or not, is much more straightforward. This, what is called a meta-study, looked at more than 9,000 researchers in 162 countries and territories. It is quite eye-opening. If you need some motivation to lose some weight, do have a look at this study, or if you're simply interested in the topic, this is going to be a study and an article I think you're going to find of interest. Do you have challenges motivating yourself to exercise? Well, as counterintuitive as it may seem, according to this March 8th, 2023 article published in Medical Express, joining a group exercise program may well entice you to do more independent exercises, according to this study. Headline: Group exercise programs for older adults led to more independent exercise despite pandemic restrictions, study finds. The leading paragraphs: sticking with an exercise program can be tough even during the best of times. But what about a pandemic? A new study by the University of Missouri and Oklahoma State University found that even when gyms were closed and there were other COVID-19 restrictions limiting face-to-face meetings, older adults who completed the Stay Strong, Stay Healthy exercise program created at MU in 2005 continue to maintain long-term exercise habits independently, which resulted in improved lifestyle changes and an increase in both physical energy and self-confidence. And this article goes on to provide details about that study. So again, if you're keen to get motivated to work out on your own, well, it may start with joining a group. Speaking of working out on your own, March 8, 2023, this article at medicalexpress.com, self-monitoring physical activity matters according to smartwatch study. Lead paragraph: by the start of 2023, hundreds of millions of fitness trackers like Fitbits or Apple Watches had been sold to people who wanted to become or remain healthy. Many consumers rely on the step counts and activity tracking provided by these devices to help them increase their physical activity levels. Users may be more motivated to become physically active when these devices ask wearers to self-monitor their activity through on-screen prompts instead of simply supplying step counts and activity tracking, according to new research from Penn State. I have to say, despite being really into technology, I do not own a smartwatch. That said, however, my smartphone does have capabilities to track physical activity, and When I've done that myself, yes, I have found myself far more motivated to, pardon the pun, take the next steps. If you are a smoker, I am not going to preach. You know the studies, you know the risks, or do you know all of the risks? In this article, March 6, 2023, Medical Express, smokers generally unaware that quitting smoking will reduce risks of dementia. Smokers are being urged to give quitting a go ahead of No Smoking Day. Well, that was 8th of March, which is past. As research shows, those who smoke are more likely to develop dementia. Those who smoke are more likely to develop dementia. So if you want to help reduce that risk, well, this is yet an excellent reason to stop smoking. And when we stop smoking, well, we're going to have a more positive life. In the Psychology Today article, March 1, 2023, headline, 2 Paths to Positive Life Change, a personal perspective. Changing your life is simple but not easy. Key points. No one has discovered a clear path to positive life change. Next point, there are 2 primary ways to produce positive life change, inside out and outside in, to maximize your chances of becoming the person you want to be. Try both paths. Try both paths. And this psychologist explores and explains exactly how to do that in this article. Again, this article, as all articles are, you will find them linked in the show notes. So there you have our treasure trove of health and wellness goodness. If you are not yet subscribed to the Healthy and Happy Senior Living Show, I encourage you to subscribe where you get your podcasts. We are on all of the major podcast applications. If you would like to reach me for any reason, email me at cartermethod@gmail.com. Until our next visit together, your host here, Stephen Carter, wishing for you and your loved ones blessings in abundance.